Welcome to the Dental Breakdown Show with Christian White. Mr. White is the CEO of White & Associates Practice Consulting. Better business, better dentistry. This podcast strives to help break down the current and everyday issues within the dental industry. In each podcast, we discuss a topic on dentistry with respected industry professionals, dentists, and other relevant special guests. Our goal is to help provide you valuable insights for your dental practice. We thank you for listening today. From the dental chair to the beach chair, wherever you are listening, sit back, relax, and enjoy the Dental Breakdown Show. Now take it away, Christian.
Let's introduce our guests to the podcast today. We have Dr. Leah McComas and we have Dr. Jake Koller of Koller Family Dentistry. Thank you both for being on the Dental Breakdown Show today.
You're welcome.
Good to hear you, Christian.
This is going to be a really exciting show, getting you both on at the same time because you both, I know you're extremely busy, and this is going to really be a lot of fun today. So I think our listeners are really going to learn a lot today. And I think what I'd like to start with is Dr. McComas. Why don't you start with you, and let's have you tell us a little bit about yourself.
Sure. A little bit about myself. I grew up in Maplewood. And so it's been really cool to be working in a dental office in kind of my hometown area and a lot of connections to the community around here. I was first interested in dentistry because of a really awesome pediatric dentist that I had as a kid. And that just kind of spurred my interest, and I thought it would be really neat to work as a dentist when I was little. Once I started in my undergraduate degree at Augustana College in Sioux Falls, I knew that I wanted to go into healthcare, but I knew that I needed a job that was focused around people and not as much around necessarily working in a lab. And that just kind of worked my way into dentistry. I ended up going to dental hygiene school first, and I did my bachelor's degree at the University of Minnesota, and continued to go to dental school there for another 4 years. And lucky for me, I was connected with Dr. Koller through one of his daughters, actually. And so that's how I landed a job with him, and I love it here.
That is awesome. Dr. Leah McComas, the patient-focused dentist. I love it. Dr. Koller, why don't you tell us a little bit about yourself?
Well, I also grew up in this area. I was born and raised in North St. Paul. And I very similarly, I had a great experience with my pediatric dentist. And I think that was an important part of kind of forming my own good feelings about the dentist. I give prizes out to kids now because that was the thing that I really looked forward to. When my dentist would say, "Oh, you need to come back for fillings," I'd be like, "Yes, I get to pick out another prize next time." I got interested as a career in dentistry from my high school counseling office, looking into different types of things. And then I sort of kept an open mind about possibly going to dental school. And I went to dental school at the University of Minnesota, and graduated from there 30 years ago. And I started off here in North St. Paul. But then I also worked in South Minneapolis and bounced around a few places. But then 20 years ago, I found my way back and purchased a practice here, and it's been just wonderful. And brought on Dr. McComas a few years ago, and she's been just fantastic. It's really worked out well to have her here.
Excellent. That's one of the best decisions you ever made was bringing on Dr. McComas. I think we'd all agree with that.
It's really working out wonderfully.
Oh, great. That's wonderful. So Dr. McComas, let me kind of flip it back over to you for a second. Let's talk a little bit about your philosophy of dentistry. I think that's kind of important for the patients and, for potential patients coming to the practice, just to understand you and just to kind of get to know you and your dentistry.
Sure. I guess that to kind of back up a little bit as far as how my philosophy was shaped, I contribute a lot of it to Dr. Koller. He's been a really great mentor to me. And so I feel like a lot of his advice and guidance and just to see how he does it and how he treats his patients has helped to shape how I treat patients. I think it's really important that patients can make their own decision about their treatment. And so I feel that it's kind of my priority and my job to let them know what I see and then let them know what their options are. And then from there, we just have a conversation about how they want to move forward. I think that one of the great things about this office and that Dr. Koller and I do is we don't necessarily sell or push dentistry on patients. We do what's needed. We do what's going to benefit the patient in the long run. We provide the highest standard of care, but we give them the opportunity to make an informed decision.
That's great. So the patient comes before the tooth, Dr. McComas.
Yeah, sure. That's a good way to put it.
That's awesome. That's not the same. That's not like that in every other dental practice, believe me. So you've got yourself a really great place to work. So Dr. Koller, let's hear from you on that.
Well, my philosophy is really about trying to help that person improve their mouth as much as they want to, make their mouth healthier. And that simply could be just educating them a little bit more on how to brush and floss their teeth. And then we work from there with the patient as far as they want to go with it. I've recently expanded the amount of orthodontics that I do because I had so many patients who desired to improve the looks of their smile by rearranging the teeth, but didn't necessarily want to go to an orthodontist and go through a full orthodontic treatment. And there's just been so much interest in products like Invisalign that are allowing people to wear clear aligners to realign their teeth. And I've been doing that type of treatment for 12 or 15 years. And but some of the things that I'm most excited about is using CEREC, where we can make crowns for people in one day. And that's just been such a tremendous benefit to our patients to be able to have a crown that we can design, custom make for them, design it specifically for their mouth, and then seat it that same day. So they're not wearing a temporary, they've only come in for one visit, and it's been so convenient. And the best part is how much healthier it is for their tooth to be able to do that. And I'm just excited to be able to provide that kind of treatment for them.
Well, I can say this, that as a father of new twin boys who are almost a year old, being able to come into the dental practice and have a crown done in an hour is a huge deal. Let me tell you. So that is great that you guys are doing that. That's wonderful.
Well, this part that I totally underestimated was the benefit to the patient on it. I was focused on, I can design this crown this way and I can do all these types of things. But the first couple of patients who I made the crowns from that same day would say to me, "You mean I don't have to come back? I can have the crowns today?"
Exactly.
And it was like, yeah, it was a real aha moment for me. Flattened my forehead a little bit, but it's saying, "Oh, of course, the patient doesn't need to come back." Mm-hmm. We enjoy seeing our patients. We love to see them. And so I was always excited to see a patient come back after a couple of weeks to have their crown seated. But now this is way more convenient for them to be able to just come in once and get it all done.
All in one visit, it's done. Wonderful. That is great. It's really a great thing. So let me ask this question then. What, when you look at Koller Family Dentistry, what makes you guys unique in the marketplace? What separates you apart? I think maybe I'll come back to you again, Dr. Koller, with this question.
I really think it's the personalized care that we give. The patients aren't a number. We have generational patients. I have some families where I have 4 generations of the same family coming to see me. And many of these patients, some of these patients have followed me around the Twin Cities, when I worked in Minneapolis and then went to Richfield and they've now been coming to see me throughout my career. And I continue to see them and I see their children and, some of them, now live further away, but they still feel it's worth the drive to come and see us here. And, Dr. McComas was, treating one of her patients here, and it was one of her elementary school teachers. And I've got my first grade teacher who, comes to see us as a patient. Wow. And I've got high school teachers who come and see us. And it's just really rewarding to be able to, treat these people who, and help them improve the health of their lives. And dentistry is just such a personalized thing. The patient is inviting us into their personal space. It's rare where you get to, in this world today, where you get to be that close with someone and share that closely with someone, especially in this age of COVID when we've all been wearing masks and standing off away from people. And social distancing. And, we are, both Dr. McComas and I are acutely aware of the fact that someone is inviting us into their personal space, and we're working very closely with them to help them improve the health of their mouth.
That's great. So, Doctor, what is it about Dr. J. Koller that brings people in? What is it about you that you get your first grade teacher coming in, you get your friends from high school coming in, they're following you, they're stalking you on the internet? No, I'm kidding.
I think it's mainly that I'm much more than just this dentist. I don't like to be thought of as just the dentist. I mean, I'm also thought of, a friend of mine likes to call me the hockey doctor, because for 30 years I've been doing the play-by-play and color analysis of Roseville hockey. And I sing the national anthem at other high school hockey and lacrosse games. And I'm involved in my church and different things like that. I try and be a real person. And that was one of the things I really saw with Dr. McComas when she came in too. She was already working in the school district here, doing lifeguarding, and just the different activities that she was already involved in. Working in the community with some of the dental projects that she was doing. And, she remains plugged in. Her parents still live in the area. And it's just wonderful to be involved in your community and just make these connections, and people come in, and the patients have really warmed up to Dr. McComas. Our neighbor was just saying yesterday how much she loves the way that she treats children. So many of the children are, and young mothers are gravitating towards Dr. McComas and the way that she treats these children. So she's got a daughter of her own. And so I think that's just made her that much more compassionate and comfortable with the treatment that she gives these kids.
So Dr. McComas, let me flip it over to you now. So now we have, a lot of patients have found you, they're coming to you. They obviously really enjoy being around you, just like Dr. Koller said. What is there about Dr. McComas that, is that piece that brings everybody in?
That's a really great question, Christian.
Well,
Partly her laugh. We got to hear.
I guess the laugh. It's the smile. I don't know. It's I know it's.
I guess I still consider myself a new grad. I still feel like I am learning something new every day. I don't feel as though I have this incredibly long-standing, loyal crew of patients that follow me all over the city. So I guess the part that we were just talking about the other day that I found really surprising is that I have had a couple new patients come in recently that are looking at our website. They're looking at our profiles. They're looking to learn more about us when they're looking for a new dentist. I think a lot of the things that patients consider when they're looking for a dentist is, how convenient is it to get to them? Does my insurance accept, is my insurance accepted at their office? And then I've had a few patients that are interested in, being treated by a female provider. And I think that that's something that is really great for our office, and that, we have different perspectives and we're able to really treat all of our patients that way. And so I guess I can't put my finger on any one thing, but I'm always surprised when someone comes in and I was reading about you online. I'm so excited to meet you. So it's kind of shocking at first, because I'm like, I didn't even know that you looked online. That's impressive.
Yeah, and I get these messages from Google saying, oh, this many people visited your website. But I'm thinking, well, they made it there by accident or something. And then I had the same experience yesterday. I asked them, well, how did you hear about this? And, oh, well, I was online researching about the different, what ClearCorrect and fast braces and things. And it's like, okay, well, then obviously she was studying up on our website. And it's like, I guess it's worth putting that information out there.
Yeah. Dr. McComas, I just think you're a patient-focused dentist. And it comes through in everything that you say. I mean, just being in the room with Dr. Koller, I mean, I'm not in the room, obviously, but I can just feel the energy. And as you're online, I'm listening to you. I'm like, I want to come see you. So get ready.
So get ready. Okay. Get ready.
Yeah, I thought you were going to come get one of those toothbrushes from our office.
I still got to get that.
Brand new Oral-B toothbrush. You got to buy it before June 30th or you can't get the rebate.
That's exactly true. I got to come get my toothbrush. So I'm going to come see Dr. McComas at the same time. You guys are great. So, all right. So all these patients are coming into your office. So tell me something. Tell me about, I'm the new patient. I'm coming in, well, what is my experience going to be like? What can I expect? Why don't, Dr. Koller, why don't I shift it back over to you? Tell us a little bit about that.
Well, one thing you can expect is that we've got very experienced and knowledgeable people at the front desk. From the moment you walk in, you're going to be greeted by people who know exactly how to do things. We've got, they both have been in dentistry for over 30 years. And so you'll be handled well from the first time that you call in. We've got a beautiful new office here that we've been in for for less than 2 years. Lots of new technology and different things that helps us do our work more easily and more readily, but very comfortable setting and surroundings. We've got individual rooms that all can be isolated. The experience is very quiet and calming, and it's a beautiful surrounding and comfortable area to be able to go through the procedures.
Mm-hmm. Dr. Koller, I'm going to shift it over to you now. About the patients, they're coming in, the new patient experience, from your standpoint, from your viewpoint, tell us a little bit about that.
I really feel like Dr. Koller nailed it on the head.
Okay.
I think that I want to put a shout out to our hygienists. I think that the majority of our patients, or all of our patients really, they meet with our hygienists at least twice a year, if not more. And if they need work, that's when they get to come back and spend some quality time with Dr. Koller and I, beyond their exam. But our hygienists are fantastic. I think that they have made a lot of personal connections. They ask about their family. They check on, how was your trip to wherever you just got back from? How was your winter down in Arizona? You must have just gotten back. They know these people personally. They know their families. And I think that speaks volumes when you can come in and spend an hour with this person and learn about their life and clean their teeth and tell them how they, can improve their oral health as well. But it's more than just cleaning their teeth and getting them out. We're not a prophy factory. We spend quality time with people, and I think that that's huge. And so that's something that I think, because the majority of our patients that are coming in are usually looking for, a checkup and a cleaning, and that's what they could expect when they come in.
And we tend to meet people at their needs. That's what we want to do. If what they're doing is they've been seen regularly at another office, but now their dentist has retired, or they want to find a place that's more convenient, well, then we'll simply schedule them into the hygiene schedule and meet them at their needs there and assess, we'll give them, we'll assess everything, do a full examination, take any necessary x-rays. But if their need is that they've got something that's hurting, we'll get them into the doctor's schedule. We'll evaluate what that situation is, and then, assess their overall dental health. And but we're not going to plug every single patient into the exact same sort of a thing that, well, before we see you in our office, we have to put you through an entire workup, and we've got to do this whole thing. We meet patients at their needs. Not everyone needs a whole total workup, and they're not all looking for what they see on some of these commercials where, you can have your entire, all your teeth pulled and dentures secured to your mouth in one day, and so that's we're not a clear choice office. But many patients are surprised to find out what clear choice really is all about. So, but anyhow, we try and meet the patients at their needs. And I think Dr. McComas is exactly right. We have some very wonderful hygienists, and they do take a real interest in their patients. Sometimes when they come in and they'll see a patient who's in my operatory for a filling or something like that, they're so eager to come in and check and see, how was that? Or how are you doing? And they want to check in, because these patients mean a lot to us. They're personalized. It's personalized care. It's great.
As I'm sitting here listening to both of you, there's two words that as a patient, myself going to dental practice, are hugely important: quality time. And, in today's world, you don't get quality time with the doctor. He or she comes in for 2 minutes and leaves. And you don't ever get to really have a relationship with the doctor. And I have experienced this. Obviously, my wife, wife and I just had twins last year in July, and I cannot tell you how poor the bedside manner was with some of these doctors who we went and saw. And of course, as a new father, I'm losing my mind, because it's like, did we do something wrong? What's going on? If you guys had seen me, you would have laughed. But it's like, that's a really big deal for someone just to sometimes grab your hand and say, okay, here's what we're going to do today. Here's what you can expect. And, these are, no surprises. And I think you guys do a great job of that. You really do.
Well, Christian, it's part of what helped me decide that dentistry was a career I wanted to
Yes.
go into. When I was in high school, at the time I was trying to evaluate what do I want to do career-wise? What kind of goal do I want to have going into college and things? And I was working as a cashier at Target. And I loved seeing all these people come through my lane at Target. I love talking to them. But at Target, your goal is get the people through that lane as fast as you can.
Yes.
They don't want to be there any longer than they have to. And my head cashier wanted me to get them through as fast as I could and things like that. Yeah. But I was like, but I'd love to sit and chat with these people and visit with them. And I noticed that my own family dentist, it was really kind of neat. I'd go to see him and he would ask me a little bit about school or about some other sort of thing that's going on. And then when I came in 6 months later, he'd kind of strike up the conversation where we left off before, ask about certain types of things. Well, now you're in cross country, or are you running track this year, or different things like that. And I thought that's really a neat profession, to be able to take time and actually visit with someone. It's not, they're here for 30 seconds and you ring them up and they're gone. And that was another thing that kind of drew me in. And so those are the personal types of relationships that I like to form with my patients as well.
The Dental Breakdown Show, sponsored by White & Associates Practice Consulting. Better business, better dentistry. They are a practice management and consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and practice visits that result in the personal and professional success of the dentist and his or her team.
This is Dr. Leah McComas,
And Dr. Jake Koller.
dentist at Koller Family Dentistry in North St. Paul. We have recently moved to a new location in the same building as the Entire Medical Clinic located behind the Snowman.
If you're looking for a dental home with a small town feel, we would love to meet you. 651-777-6454.
I'd like to take a little bit of a right turn, and I'd like to focus on, the people behind you that help you to be successful, which is our team. Our dental team at Koller Family Dentistry. Why don't you talk a little bit about them and how they've helped you guys to be so successful?
Would you like me to start with that one?
Please.
Yeah, so I guess I think the best word to describe our team is impressive. I think that the way that this office hums on a really busy day, there's people coming in and out of here, there's doors opening and closing, there's all kinds of people, commotion at the front desk that's all organized, and everybody knows what's going on, even though it kind of looks from the outside like there's a lot of things happening. We couldn't do that without our team. From the first person that the patient sees when they walk in, our front desk staff is fantastic and efficient at checking patients in, getting them organized, getting all the paperwork they need, and then either a hygienist or an assistant is coming and bringing them back to their operatory. Usually, within, I'd say, 5 minutes from when they walk in the door, or even shorter. Our patients don't wait very long, and it's impressive to see how everybody works together. I could not do my job without them, obviously. And even when I try to be self-sufficient and I think I'm helping by letting an assistant do something else, I'm usually causing more trouble. It's more impressive to sit back and watch sometimes and see how everybody has their role, but yet our team works fantastic together. And that's really fun to see.
That is really fun to see. Oh, go ahead, Dr. Cole. I'm sorry.
Christian, I would say that the team is not just behind us, the team is alongside us.
Mm-hmm.
And they're critical to the success that we've had as an office. I echo and actually amplify what Dr. McComas said. I couldn't do what I do without them. They do so many things around here that allows me to shine. And it's just, I can, walk into the office and know that people are taking care of my patients up front, and my assistants are taking care of everything back here clinically. I've got a team of hygienists that are taking care of the maintenance and health improvement of the gum tissues, and really satisfying the patient's recall needs. And it just frees me up and encourages me to know that what a great job they're all doing. And it's a wonderful thing to see this humming along this way. Over 20 years ago, I was working in an office in Bloomington of a dentist who had his practice well established, beautiful setting, all this. And I remember looking at him and just being like, man, he doesn't know how good he has it. He just walks in the room and he's got this staff that already is doing everything for him. Man, he should. Now that's what I have.
Yes.
It's amazing. So I'm very thankful. I feel very blessed to have to be surrounded by such a wonderful team. So.
I like the fact that both of you kind of said the same thing. The team works alongside us. We're not out in front. They're working beside us and along with us. And that's just an unbelievably great attitude to have. And that's not the case in most dental practices, believe me.
And in some cases, they've helped bring us along. I learn things all the time. And I know Dr. McComas has learned things from the assistants being able to help with things. And a couple of the assistants that we brought on in the last year, they had a great deal of experience, and they were able to share some of their knowledge of things that they've picked up throughout their careers that has enhanced the knowledge that we already had. Some of the best things I ever learned weren't from my instructors in dental school. They're from dental assistants that I worked with, whether it was in dental school or in my office in Minneapolis, or just throughout working with them here. We all have the opportunity to learn new things all the time.
I've been lucky enough to work in a few different offices as my dental career has gone. And one thing that I feel that we have in this office is that the hygienists and the assistants, they almost have things going so smooth and so efficiently that I sometimes feel like I'm coming in on the tail end of things because they've already kind of taken off and they know what's happening. And I'm like, oh, wait for me. And other times at different offices, I feel like I have to be the one, encouraging and prodding and helping progress the appointment. And here it's not like that. And I think that is a benefit to our patients because it's using the most efficient use of their time. I mean, their time is valuable too. We can't assume they have all afternoon to sit with us.
And my assistants oftentimes are, coming to me and they're asking, well, what did you want to do about this? They're so concerned about that patient. They're looking ahead to that patient's next appointment. Or, the hygienists have done similar sorts of things that they're already making plans ahead for what this patient might need or talking to them about things. So it's just wonderful to have these staff members that take such an interest in these patients. And we got these front desk people who they'll remember, oh, that's right, this person said they wanted to get in before their wedding on this day. So we had an opening. Yeah, we're going to move this around and get them in here. And if we shuffle this person here. So it's just great. Everyone brings their own unique skills, and together we can do some tremendous things and help lots of people make improvements to the health of their teeth.
The Dental Breakdown Show, sponsored by White & Associates Practice Consulting. Better business, better dentistry. They are a practice management and consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and practice visits that result in the personal and professional success of the dentist and his or her team.
Well, I would say you're improving people's teeth, both of you, but you're also changing lives too. And I've been in your office, and and some of the cases that you have can be pretty complex, and you have people who come in there in different states of disarray in terms of their thoughts on dentistry. And you guys have both done just an unbelievable job of just making such a calm environment that patients come in, they listen, and they're like, gosh, of course, yes, I want to go ahead and do this just because I want you to have you work on me because I trust you, Dr. McComas. I trust you, Dr. Koller. And that is such a key piece that a lot of dental practices miss that.
And sometimes all we need to do is just a simple little improvement to something.
Yes.
I had a patient come in recently who they were very dissatisfied with the dentures that they had made, and they didn't feel they fit and all these different problems. And I simply in a short period of time was able to evaluate a few little things to be done, and nothing major, but made a significant difference in their in the way that the dentures fit, and took something from unsatisfactory to being very satisfactory in a short period of time and with little expense to the patient. And they were so thrilled, and I really felt like it wasn't that big a deal, but it is a big deal to them. It wasn't my problem I was dealing with, but I was able to help them solve their problem.
Oh, you guys are doing a great job of that. Congrats, let me tell you. I have been like I said, I've been in the office. I walk up to the front desk and Sherry is there, and she's always got a smile, and you can just feel the positive vibe coming from her. And that's really nice to walk into an office, and that's the first person you see, and that's the first experience you have, and with the person at the front desk. That's a really great thing. You guys have both done a great job of creating an environment like that. You really have. My hat's off to you. All right, so I'm going to ask you guys, one last question, and this is going to be really exciting. Okay, I've been waiting for this. All right, so I know, but get ready. So Dr. McComas, I'm going to start with you. Is there something that you would like to share with us that, about yourself that people may not know about you? And this may be, maybe you have a hobby, or maybe there's something else fun you do on the side. I think patients and I think people would like to know about that.
I'd like to know about that. When I was in high school, I was a competitive figure skater.
Wow.
Wow.
Whew,
I know, it's something
I would have never guessed that.
Know about me. So, little fun fact.
Awesome. So how many years of that did you do?
Probably about 12.
Man, wow. So you did it competitively?
Not until I was probably about 15. But before that, yeah, I was on a synchronized skating line for a couple years, and then I was competing individually. And when I graduated high school and decided that wasn't something I was going to bring competitively to college, my parents were thrilled not to spend more time in an ice rink for a while. They were excited to not be paying coaching fees and ice time anymore, and they were ready to stay out of the rink.
Nice. That's great. That's a great fact to know. That's awesome.
Yeah.
Okay, Dr. Koller, I'm going to switch it over to you.
Well, the thing that often surprises a lot of people is to know that I played lacrosse for 20 years here in Minnesota. I coached lacrosse for another 15 years, and I also officiated lacrosse for 5 years in the middle of that. And even among lacrosse players, they'll say, well, did you play out east or something like that? It's like, no, I started playing here back in the 70s. When I was in high school, there was a men's team here, and long before the sport was ever really popular here in Minnesota, I was playing with my brothers and a group of guys that they had formed a club out of the University of Minnesota. And it was just a men's club here in the Twin Cities that we played for a number of years. And then after that, it grew into, we started forming high school clubs, and then became an official sanctioned high school sport. And I coached in high school for about 15 years, and I've done some youth coaching, and I still really love the sport of lacrosse. It's gotten in my blood, and I'm very passionate about it. So get me talking about lacrosse, and it's going to be a long conversation.
That's when we have to go in and say, Dr. Koller,
yes,
time
to
to
go.
Yes, thank the dental
Other
assistant.
patients waiting.
That's awesome. Well, that's a great thing. I didn't know that. Wow, I'd love to sound and learn more about that, because wow, that's great. Let me tell you, it has been a real treat to have both of you, on the Dental Breakdown show today. Dr. McComas, Dr. Koller, thank you so much for taking time out of your busy schedules to be on the show today.
It's been our pleasure, Christian. Thanks.
Thanks
Wonderful.
for having us.
So for all of our listeners, and for all the potential new patients who are out there who are looking for a dentist, if they want to find out more about you and for your practice, where can they go to get more information?
Sure, they could find our website online at www.jkdentist.com, or they could give us a call, 651-777-6454.
That's 651-777-6454.
Thank you for listening to the Dental Breakdown Show with Christian White. If you would like more information about today's topic, have a topic suggestion, or would like to be a guest, please check out the description below. Or for more videos, podcasts, and information, please visit whitedentalconsulting.com/podcast. If you liked the podcast today, please press that like button, subscribe to our channel, and hit that notification icon to become a part of the growing Dental Breakdown Show community.